Good afternoon and welcome to our podcast. My name is Tulina Eren and I'm the founder and owner of Green Mind Health Consultancies here in Dubai. I would like to introduce you Mr. Rami Al-Khalil. He's also a senior psychologist working for our company. We have a very important topic today. It's about the ADHD, which is also known as the Attention Deficit Hyperactivity Disorder. So, Mr. Rami, please tell us something about the ADHD.
Yes. Before we can define ADHD, we should know what's the ADHD. ADHD is Attention Deficit Hyperactivity Disorder. This is two parts. The first part is attention deficits, and the second part is hyperactivity and impulsivity. In general, people with ADHD show continuous pattern of inattention and hyperactivity, which affect on social development and which affect on behavior of them, and also it affect on doing activity.
So how do I know if my child suffers from ADHD?
Yes, as a teacher or as a father or a mother, what I can observe or what I can notice when I observe my child, the first things, let's go to attention deficits. I can notice my child is often fail to go in details or make mistakes in doing activities. The second point noticed my children is doesn't listen to me when I spoke directly. Also, I can notice that, for example, a student doesn't follow instructions inside the class or, for example, in public places. He didn't go through instructions, and also there is a point he failed to finish the homework. He began, but he most of time fail to finish the work.
Are there any further signs or symptoms, for example, when it comes to general activities?
Yes, also there is a big symptoms we can notice on this. He's often fails in organizing the activities. Also, for example, he avoid or dislike to do activities that required mental efforts for a long time.
What else can you tell us?
Yes, also I want to share, this is a very important point. These symptoms not for one time, happen for one time, or for example, for short time or in school, but they didn't happen in the at home. But these symptoms should happen in both the school and the class and every place and for long time to assess this child with ADHD. And this is also do assessment. This is the psychologist work and the psychiatrist's work. But this is very important to notice that he can forget to to take and to bring the necessary tools for him. For example, as a student, he forget to get, for example, pencil, books, and for adults, they forget to get, for example, sunglasses, mobile phone, bookwork. What's else? And this is we can notice on them.
So they also get, I think, very easily distracted, right?
Yes, this is يعني this is often happened because he cannot concentrate and he has lack of attention, so he is easily to be distracted.
Yeah. So what we could also tell that it's a daydreamer. A person with a hyperactivity disorder is usually a daydreamer, right?
Yes, yes,
Yes.
that's right.
Yeah. Right. Let's go to the second part of the disorder, which is the hyperactivity and impulsivity. Please tell me more about that.
Yes, this is second part of the symptoms of ADHD, hyperactivity and impulsivity. What we can notice, he's often fidgets and taps hands or feet and squirm in the seats. Or we can notice him to stand up when the situation requiring to be sit. For example, if he is inside the class, the situation is, for example, if the teacher asks him to sit, he cannot wait for just 2 minutes and he will go and stand up. Yes, this is يعني usually what happened with ADHD children.
So they cannot remain seated. They will stand up immediately and
Yes,
walk around. And
yes, in situations that the children, the situation required to be seated, he cannot do that. To wait, for example, also to wait in his turn. Yes, he want to go and to do randomly because, as I mentioned before, he's not organized in doing activity.
So also when it comes to leisure and like play, when they have to
Yes.
play games.
What happened in this case? In this case, we can look at him. He play randomly, and what we can notice from friends or colleagues, they didn't prefer to play with him. Why? Because maybe because he play randomly and maybe harm his colleagues in class. Yes, because he is playing in the way randomly and not organized.
So what can you tell us about the way they talk? Because I think you've mentioned before that what they do is always very excessively, the way they do something, like also talk in an excessive way, correct?
Yes, this is, for example, if we يعني notice that for talking, they talk in excessively way. Yes. Also, يعني if you look at him when you ask him to do, for example, one thing, you can notice that he is acting as a driven by an engine. Yes, he go fast and directly. Maybe the teacher ask him to go to get some things, he go directly, and maybe he crashed on the hole or crashed in the board. يعني this is what happened because he has a power and he want to distract this power in activity.
So, which means also that this person, the child or adult, does not have the control about this power, right?
Yes. Also, what we can do, for example, as psychologists, to help him how to control
Exactly.
his behavior inside the sessions and for long time.
Exactly.
This is what happened gradually, beginning from 5 minutes, 10 minutes until to sit all the class period.
Like small step
Yes,
by step.
step by step. This is what happened.
Yes. So, what do you think about, when it comes to, you mentioned just like the step-by-step, session, like consultancies. What else would you recommend? I mean,
Yes.
what can I do as a mother or as a teacher?
Yes.
Are there other?
The first recommendation is يعني I recommend that to go to a psychologist to do assessment for the child This is the first point. After doing assessment, the psychologist will put a therapy plan, behavioral therapy plan. If the child, according to assessment, need medication, also the psychologist can refer the case to psychiatrists for medications, and the therapy, behavioral therapy, go together with the medication. And this is also depend on the therapy time and the sessions, and it's will took a time, long sessions. And after that, there is from my previous experience, a lot of children get improved and get treated from ADHD after had sessions therapy with psychologists.
Like couple sessions. This is also something I know from Europe, that they do go to a psychiatrist in order to get the medicine, Ritalin,
Yes.
and go to the psychologist in order to get the behavior, like the way they have to behave, this kind of treatment.
Yes, this is. It's also depend on the age of the child.
Yes.
Before 5.
Sure.
Always we do a behavioral session, and more than 5, and with recommendation of psychiatrists, there is a medicine, and the medicine with the behavioral sessions. And it will be very useful, and it took a time, but at the end it will be there is improvement. We can notice that.
So a satisfying, you can say like a happy ending, like a satisfying situation for children, the children in general, and also parents and the whole environment, teachers, and so on.
Yes,
right.
This is the goal. This is the goal. That the all parents, all teachers, that waiting from the sessions.
Yeah. So let's just go to some examples. What can you tell us about your students or the adults even we've worked with? Do you have some special cases you would like to mention, or is there anything else you would like to add concerning, the attention deficit hyperactivity disorder?
Yes, I want to refer to one point. Maybe we can notice attention deficits without hyperactivity.
Exactly.
Or we can notice in some cases hyperactivity and impulsivity without attention deficits. Not all the time we will observe or assess together. We will notice, for example, some children just have attention deficits, and another have hyperactivity and impulsivity, and some children have both attention deficits and with hyperactivity and impulsivity. Yes. For example, from my previous experience, I worked with many children have ADHD, and they diagnosed with ADHD, and after doing behavioral sessions in plan therapy, and depend on the doing, for example, practicing and activities for increase the concentration, increase the attention for a time, for long time. This has happened gradually, depend from 5 minutes, 10 minutes, and increase to let him, for example, sit for 1 hour and doing activity in this time. It's very helpful for them.
What would you say when it comes to adults? What would be the best therapy? Because there might be also differences between hyperactivity disorder when you have children, and also hyperactivity disorder or or attention deficits when we have adults. So what can you tell us about the disorder when it comes to adults, when we
Yes.
deal with adults?
Yes, this is also something that adults should do. For example, to practice on, for example, for a time to sit and focus on, for example, doing one duty, and to take, for example, a mission as a parts, the first parts, second parts, and doing every parts is as a single, yes. And also, يعني this is can help the adult to do, for example, something to control their behavior, or to, for example, also write notes. For example, what I to remember, to
Yes.
remind him to
Right.
do inside the workplace or at home.
Yeah, I've heard that also adults, they try to get involved into sports to prevent even, become more hyperactive. And so is this something you could also recommend?
Yes, this is outside of the work environment. If they do, for example, exercises and regular exercises, and it will help them to be charged
Exactly.
yes.
Like get off the energy,
Yes,
the
get
energy
out-
which is
yes,
like
yes,
overloaded energy.
yes,
Right.
yes. This is
Yeah.
what
Right.
they need to do.
So usually, how long does it take to get either a child or an adult under control, if I may so? Because would you say it's easy to deal and find a solution within a couple of weeks, months? Could it take years until the person, let's use the word, recovers?
Yes, it's depend on the case by case.
Yes.
And after assessment, we put a plan therapy. It's take months, and it will take maybe until 1 year. Also, it depends on the activity outside of the clinic, in the house, because also we give a homework and activity and practice to the parents to do it with the children.
Yes.
Also, there is activity we give
to the wife or to the husband,
yes,
probably.
yes,
when
of
it
course,
comes
to the
adults.
parents
Yeah.
and to the teacher in
Yeah.
the class, because
Of course.
a lot of teachers ask what I can do with this child.
Yeah.
It's annoying me many times
Yeah,
and
yes.
interrupting me in the class, inside the class.
And-
what I can do, and they need to find a solution for this case, yeah.
Yes,
Because it's also affect the other students inside the class.
Exactly, and it could be only one student who is hyperactive, and the other 20s are fine. But because of that one student, the whole class gets
Yes.
confused and interrupted and destroyed, kind of.
Yes,
Yeah,
yes,
exactly.
yes. That's
Yeah,
affect
yes.
negatively on the class environment.
Yes. What would you say about adults when it comes to relationships? So adults suffering from, ADHD in relationships. Is there anything you can tell us about this part of the situation?
Yes. We can notice when you have, for example, a relationship with someone with ADHD, you can notice that he forget for many times. Forget the appointment, forget something, and he prefer not to sit for a long time and to speak and to be listened. He talk excessively and not didn't listen to others. And maybe you have a problem with him or her, because you didn't feel that he didn't listen to me. For
Yes.
example, or he didn't listen to me. So maybe in يعني and for adult they can control themselves more than the child. Yes. Also, if there's
Interesting.
يعني
Very interesting.
a treatment in the early child and get treated, it's يعني this is very good, and we cannot and we didn't find there is يعني still symptoms, and it will be more capable to concentrate and to be attention and to control the behavior and the emotions in all situations.
Yeah, so the prognosis are quite good, right, as far as I understand.
Yes.
Do you think that, let's say, I have a friend who's married to a man who suffers from ADHD. Do you think it's better to have them as a couple, to have a couple session first, or would you still go on with the patient, the client who suffers from ADHD, or both?
Yes, it's depend on the need.
Yes.
Depend on the need. For example, if we need to have sessions with couples, we invite them as a couples. If there is something is related to both of them, we can sit and give him what not individually, both sessions for couples. But if we didn't need this, we can go individually. This is according to the needs.
Maybe some more examples, because we want to want to show the parents and the adults and also the students, the teachers, professors, what do I have to do in this situation? So what is the first task? How can I help this child? How can I help my husband, my wife, my student? What can I do from parents' sides, from even from teacher sides?
Yes, as I mentioned before, what we can do as a teacher, I can give the students one activity and one short activity and let him do this activity. After that, I give him another activity, and also I should give him a support. Yes, after he finished. Also, I can give him, for example, activity for 5 minutes.
Mm-hmm.
When he did the activity, I support him.
Exactly.
After,
or you probably also could tell him, "Oh, you did well," just
yes,
to give him a compliment.
Maybe yes.
Yeah.
Maybe this support will be something is variable, just, and maybe support as a small gift.
Wow,
yes,
very
to support
very good.
him to sit more time. The next step is to increase the time gradually. For example, until it will be also 5 minutes. It is quarter. Yes. After that, also this is happened gradually, and take him, for example, to take activity and for movement, and after that we can return and complete and continue the activity.
So what do you think? Because in Europe, it's very common to have like extra classes for children with ADHD. So it means that they do not go to the general classes. They have like an extra class. So let's say 5 children with ADHD go to separate lessons. What do you think about this system?
Yes, this system also in UAE. This is a class inside, most of the schools, there is the class for disability. Yes, and there is a teacher of
disability in a very bright way, of course, like covering lots of subjects.
Yes.
Right.
If the child is diagnosed with disability, he should go to this class, maybe for example, for short time or for all the time of the class.
Yes.
This is this is here in the schools. and it's the also need coordination between the psychologist and the inside the school and the teacher of disability, yes, and the teacher, for example, for subjects, for math, for Arabic, for any subjects.
Yes.
Yes, there is also individual plan, external individual plan for those students. Yes, this is external and individual plan just for them. Beside the general plan for all students, this is additional plan for them. It's very helpful. It is also not just for example, the subjects, for all activities, also for exams. Also, what I mentioned, there's a important point to be focused on. It is inside the exam, he need or she need as a student to be followed by one to ask them to answer all the questions, yes, and to read all the questions after that answering, and to ask him to sit more all the time and read everything and answer everything, because they didn't like to sit. They want to just to go and to move.
So just to finish quickly,
yes,
and to leave.
And go.
Right.
So they lose. They when I, from my experience, I feel someone is very clever and he's can continue and can doing good inside the class. When they go to the exam, they get
nervous, probably.
Yes, also weak. They weak
because
mark.
There's like a fear. You're nervous. You have like a fear of failure, or you think that, oh, I might forget everything I've just studied and repeated. Yeah.
Yes,
it's
also,
like the pressure.
Yes. Also, they didn't had low marks. They had low marks.
Yeah.
Why?
Even though they were prepared, intelligent, able enough to go through and to pass the exams.
Yes.
Which is of course very sad.
Yes. Also for parents, they are facing a lot of trouble because of of behavior.
I can
Why?
Imagine.
Why? Because when, for example, a teacher inside the home, or if the mother want to teach them, for example, he just want to sit for 1 minute or 2 minutes and leave. It's very difficult to control him. Yes, it's very, very difficult. Also, this things is not easy to handle with ADHD child.
It's quite a challenge, isn't it?
Yes, of course. This is a compliment from most of parents and most of teachers.
Of teachers.
Yes, I faced a lot of cases in the school. The teachers tell me that, please, what I can do with this child, how I can handle, what I can give him, for example, activities, or what I can do.
Yeah, exactly. And I do think that in our time we have also so many games, computer games available, movies which are not really good for children. So do you also think that might have an influence on the ADHD in general, or some kind of?
Yes. If for ADHD children, it's very good not to give him a tab or electronic games.
Because these are normally very nervous games, I have to say.
Yes, nervous games.
Aggressive, nervous, or very stressful, also movies whatsoever. So which could actually make the situation even worse.
Yes, exactly before sleeping. Yes. Also,
right.
there is some foods. If we notice that after the child eats some foods, for example, sugar or what.
Exactly.
Yes.
It makes them act
Yes, make
more active, like
more
hyperactive.
active.
Yeah,
Yes.
yeah.
We should
So
just
chocolates
control.
or, yeah.
Yes, control
Amount
the
of
amount
sugar
of sugar
and
yes,
food in general.
the quantity of
Yes,
the foods.
absolutely.
Yes, and this is يعني very helpful.
Thank you very much again for watching. So as I said, we are from Green Mind Health Consultancies Business Bay. Our website is www.greenminduae.com. We're here for you all the time, anytime. Feel free to contact us. Have a great day. Thank you.